This meeting to order. Welcome to the New York City Health and Hospitals public hearing. Please note we have Spanish interpretation available. Please call 212-788-3359 if you need these services. Registration is open until 6:30 at the entrance of the auditorium. And the number to call is 212-788-3359. My name is Jose Pagan. I'm the chair of the Health and Hospitals Board of Directors and the chair of the Capital Committee. I would like to take this opportunity to introduce the other board members of the board and Capital Committee who are here with me this evening. Vanessa Rodriguez, City Council designee for the board of the Bronx. Sally Hernandez Piñero, Frida Wang, Dr. Jean Wright, and our president and CEO, Dr. Mitchell Katz. So also on this panel are Andrea Cohen, Senior Vice President and General Counsel and the moderator for the evening, and Colicia Hercules, Secretary of the Corporation. This hearing concerns a proposed lease by the NYC Health and Hospitals Corporation to River Commons Owners LLC for the development of River Commons, a new mixed-use building on a 42,000 square foot parcel at NYC Health and Hospitals Gotham, Morrisania, located at 1225 Girard Avenue in the Bronx. The new building will include approximately 328 units of affordable and supportive residential housing for both the community and patients, as well as a live-in supers unit, community facility space, and approximately 41,000 square foot of healthcare facility and a 75-car parking garage for use by NYC Health and Hospitals and a public plaza. Additional approvals by the Office of the Mayor and the City Council must be obtained pursuant to New York City Health and Hospitals Enabling Act. I would like to thank all of you for participating in today's public hearing. We look forward to hearing your comments on this matter. We will now have a presentation by Annie Tirschwell, Principal of Type A Partner.
Hi, everyone. I'm not usually this far from the screen, so I'm going to be hope I can not get too nervous. So I'm Annie Tirschwell. I'm principal at Type A Projects. I am joined here today by my other development partners, Shali Sharma from BronxWorks and Emily Johansson from L&M Development Partners. And I'll just say a little bit about myself and our other partners, although I assume you know BronxWorks very well, obviously being so steeped in the Bronx. So Type A Projects is a women-owned real estate development company, which is a bit of a unicorn, not just in New York City, but across the country. And we focus only on building affordable housing. We've built it across New York City, although primarily in the Bronx and also in New Jersey. Again, only affordable housing. We have over 1,000 units completed. Again, a real commitment to the Bronx. I'll talk about that a little bit more. We find ourselves in Community Board 4 territory, which is a group of people that we've been working with for close to a decade on other projects. And so feel really pleased to get off at this subway stop yet again as we look to build yet another project in the Bronx. So BronxWorks, again, represented by the Director of Supportive Services for BronxWorks, is here. They, as many of you probably know, have over 50 years of experience working, providing social services across the Bronx. They're in 50 locations at this point and serve about 64,000 residents annually. They feed, shelter, teach, and support the people of the Bronx. And what's so impressive about them is they're not just a superstar. It's like they're the super network across the Bronx. And they provide services from everything from small kids in pre-K to seniors with senior services. They do benefits assistance, education and youth development programs, legal and immigration services, just to name a few of the programs that really stand out in their portfolio. L&M, what am I doing wrong? Oh, really? Oh, sorry. Thank you. See, I didn't click. I told you. Sorry. I'm just old enough to be completely illiterate technologically. We're also joined by L&M Development Partners, as I said, which is an incredible anchor for this project. So you've got a women-owned real estate development company, a not-for-profit organization doing the Lord's work for decades in the Bronx, and we have L&M Development Partners who will be our builder, but also provide the deep level of experience building affordable housing, impact-driven affordable housing across New York City. They have over 40,000 units already completed. And so having this development team work together brings both the depth of Bronx-based development with the incredible delivery record of both L&M and, to a lesser extent, but we think important extent, L&M Type A projects. Next slide, please. So again, as I got off at this subway stop just now, it's a subway stop that I am incredibly familiar with, and that we have spent the last almost 10 years building a project 2 blocks away from the subway stop, just on the Harlem River, called Bronx Point. Again, it was a Type A, L&M Development Partners and Bronx Works Development. It's got 542 permanently affordable and units, a portion of which almost 100 of them are supportive apartments. We have built a core and shell for the Hip Hop Museum, which is mostly how people know the building, fortunately. And it's about a 50,000 square foot shell, and they have begun construction this summer and look to be open in the next 12 to 18 months. We're incredibly excited to have them as our cultural community facility anchor. So at Bronx Point, Bronx Works is a development partner, but they also provide social services for the supportive housing tenants. And they also are just about to open a pre-K space on the ground floor. So really putting their best practices to work at Bronx Point, both as part of the development team and as a service provider. If you guys haven't been over to the waterfront recently, you should. It's actually gotten incredibly popular with the kids, which we're trying to sort out. But it's about, we provided in tandem with this development about 2 acres of open space. And I think part of the reason that the kids are having so much fun over there is because we hired an incredible MBE landscape design firm who has created world-class design that was executed at the waterfront, not just for our residents, but for the entire Bronx community. And it stands shoulder to shoulder in terms of the quality of construction and design with Manhattan and with Brooklyn. And so we're really pleased that we've been able to bring such high caliber open space to the community. The thing that makes that open space even more exciting to us and to myself personally is the amount of time we spent with the community, particularly Community Board 4, designing that open space. And so it was over a 2-year process with the community members, again, mostly through Community Board 4, but in going into senior centers, canvassing folks on the street, and in Mill Pond Park, which lies adjacent to the building. And it was just an incredibly collaborative and rewarding experience for everyone involved. And the other thing that came out of that deep relationship with the community, which is something that we're looking to do on all of our projects, is a workforce development program that Community Board 4 asked us to collaborate on and to create, which introduced hard to reach 18 to 24-year-olds in the community to express to them what happens, like how do you build a building? What are the different jobs that get produced, not just construction, but also management, development. You know, the world is really out there to be explored, and to see a building go up and not really understand how they could be part of it professionally, we thought, and the community board thought, was a mistake. And so we corrected that with a week-long program for 18 to 24-year-olds, involved training, OSHA training, and resume help, as well as interviews with lots of different folks responsible for the development. So we're super proud of that collaboration at Bronx Point. Again, the exact same development team that will be developing the project we're here to talk to you about today. So next slide, please. So just to sort of orient you, again, most of you probably spend a lot of time here in the neighborhood. The building is part of the lot that we will be building a building on, is part of a rezoning that the city undertook in 2018, the Jerome Anthony rezoning. And that rezoning, one of the major goals of that rezoning was to create more opportunities for housing, particularly affordable housing in the community. And so once that passed, HPD shortly thereafter in 2019 in December released an RFP, which, as you guys all know, is a big piece of how the city builds affordable housing, is by leveraging city-owned sites. And so we, Type A Projects, L&M, and Bronx Works responded. And in 2 years thereafter, in December of 2021, we were awarded the site. So, you know, it's a big site, and it does often take time for all of our partners to choose the right development team and the right development execution. We were super excited because we had an alignment with Bronx Works, and I'll walk you through how that played out. So we, I guess we matched their level of enthusiasm, matched ours. And so where we ended up was being awarded, and the program that we'll be using through HBD is what they call an ELA program, which is targeted to extremely low and low income individuals in the community. As many of us know, when we talk about affordable housing, people say affordable to whom? And this is HPD's most targeted tool for providing housing for the lowest, extremely low and low income individuals in New York City. So we were thrilled to be able to meet the community, we think, where they needed to on income and rent levels. So obviously we're sitting here today in a H&H meeting. The partnership with H&H, which has evolved over time, has become so incredibly exciting to us. Obviously, we're sitting on city-owned land, we're sitting on H&H land, but as we started to dig in and really understand how we could be working collaboratively to advance the mayor's housing plan, but to do so with some great brains in housing, some of the best brains in public health, and how do we make this site serve the general public, has really evolved over time, and we're really proud and grateful to be part of that process. Next slide, please. So for those of you who don't spend a lot of time right here, or in the south, not right here, but almost right here, the existing conditions of the site is basically, well, it's a parking lot, and the parking lot houses H&H cars, or cars parked for H&H facility. It is a gigantic piece of rock. So that retaining wall is just a retaining wall that is covering a gigantic piece of rock, which is not unheard of in the Bronx, but it's obviously part of the reason it hasn't been developed yet. Talking before, land is scarce in New York City, so not only is it a giant rock outcropping, but it's also next to an elevated train. So we're sort of leaving the last scrubs of land, you know, to be developed, but both Type A and L&M have a lot of experience building next to MTA structures. And so we were not daunted and excited to approach the site, just not letting, any of the constraints really contain our enthusiasm for what we could build there. Next slide, please. So just to orient you, and if I was closer, I could run up there and show you, but the orange rectangle is where we plan to build the new building. And soon you'll also hear about a plaza, a public plaza that we're building at the same time as the new building. In order to do so, we need to demolish a small annex, not so small, an annex for Gotham Morrisania Clinic to make way for the new building. And as you'll also hear in a second, that new building will house a 42,000 square foot expansion to the clinic. So a little bit of a short-term juggling as we move some of the H&H programs into the Morrisania Clinic in order to demolish the rock outcropping, demolish that annex, and then start construction. So that orients you to the site. Okay, so I'm going to dive into the building, and then I'm going to dive back into sort of how excited we are about the relationship with H&H, but just a little bit about the building. So 328 affordable units, which we're excited about because the city, as we all know, is going through both a housing crisis and an affordability crisis. And by utilizing HPD's ELA program, we can both build housing and address the housing crisis for folks who are incredibly rent burdened in the Bronx. So we're incredibly excited that we were able to build that much affordable housing. I'll talk a little bit, again, we're going to be providing open space and space for community facility programming as well, which I will get to further down the slide, and then I'll show you where they live on the first floor. So H&H will occupy about 43,000 square feet for their expansion clinic to Morrisania, which we understand is their most busy and popular clinic in the city. And so obviously building a brand new world-class expansion to that facility was exciting for us, but will be even more exciting for H&H, and even more exciting, I imagine, for the community who will continue to access world-class services right in their own communities, So the parking garage that we're demolishing will soon be, that those spots will be integrated into the building. So we will retain parking for H&H. The parking in the building is only for H&H. So not for the residents, just for H&H. We understood how critical it was for H&H to retain their parking for their staff. And so we were pleased to be able to make that work, which actually wasn't particularly easy because, again, we're sitting on rock. Part of the 328 affordable apartments will be supportive housing units. Those are units for folks either coming out of homelessness or at risk of being homeless. One of the things we have evolved since working with H&H is that those supportive housing units will come through an arrangement with H&H where H&H will identify and help navigate those tenants into the housing with BronxWorks and with city agencies. So we're so taken by the opportunity of being able to support the H&H system by having folks in need of supportive housing who are currently utilizing H&H for their medical services being a conduit into housing in the building. So not only will the entire community get to have a new health clinic, but 328 units of people living there will also have access to a world-class health clinic. And then some of our most fragile tenants, the supportive housing tenants, will be able to just go downstairs to receive services. So incredibly powerful for us as developer, for H&H, and obviously for the folks living there, including the supportive housing units. We're going to have about 6,000 square feet of community facility space through the African Resource Center and BronxWorks' Empowerment Center. The African Resource Center will be providing a range of social services, including legal aid, to the entire community. It happens to be that this part of the Bronx is home to many African-speaking New Yorkers, and so that's how this became the sort of a fixture in the project, but they will provide services to the entire community, and obviously BronxWorks will expand into the building and provide services, as they always have, to individuals across the Bronx. We will also have 7,500 square feet of public community open space. And I encourage you to go look at Bronx Point just down the block on the Harlem River to get a sense of what's to come. It's a much larger space, but the caliber of our execution, I think, will be evident. So we're also really excited that the MTA wanted to reserve the right to have an easement here for an MTA ADA accessible elevator and stairs. Well, MTA elevator, accessible elevator and stairs. Obviously, having a health clinic with a subway station that's not ADA accessible doesn't make a tremendous amount of sense. And so we're really excited that the MTA has put their stake in the ground to have an easement for a future ADA elevator. So we're super excited about that. In working with an H&H, we realized how incredibly critical it was that the work to build this building would not disrupt what goes on at the clinic. And so while we've already finished renovating the existing clinic to accept folks that were moving out of the annex so that we can demolish the annex to build the new building, including the clinic. We've done so very collaboratively with H&H, such that there will be no disruption in the continuity of care at any point during our development. clinic, and so we were gonna offer off-site parking. During people close to announcing it. We're not quite there yet, but no reason to be concerned. We are just, building here takes long. So the building itself is going to be about 17 stories at its highest point. We presented a different building months ago to the council member, and she thought that we needed to work harder on it. So we took her counsel to heart, and we worked as well with HPD, who also really encouraged us to take this large 17-story building and articulate it so it didn't feel like it was gigantic mass looming over the community. And so what we created is a very elegant, but almost three-section folded building that we hope will be an undulating facade and not feel like this sort of massive flunking building on River Avenue. You'll see that the buildings themselves are different heights in order to create some variety in the massing. And then when it gets to the ground level, because you do have the train, which is going to obscure a lot of the building from the street, although you will see the building from all over. And we spend a lot of time going to high and low streets around the neighborhood. That will be a different materiality. That's going to be metal panels along the base, and that's where the second and third stories will be the clinic. And so we thought, and I personally thought it was really important, if you're going to have this expansion to the health clinic, that it gets articulated on the front of the building so that people in the community see that there's a health clinic that they can access. It's not obscured in a residential building. And we're going to work with H&H to create signage so that when you're passing on the subway, there's tens of thousands of people every day passing on the subway should see that there's been an expansion and that they realize and remember that there's community healthcare that's accessible to them. So articulating that on the front of is important to us. I'm going to talk about it a little bit further in another slide, but we're going to take this rock outcropping, which is pretty desolate, and really create a vibrant ground floor activation. So that was another piece of HPD's priority for this site. And you're going to see a slide where I think we've hit the nail on the head. So that we create a pedestrian experience that's safer and more friendly. Building sustainable buildings is in the ethos of both Type A projects and certainly of LNM. So here we're going to have renewable energy sources, including solar and geothermal. And the building is being designed and built to be an extremely tight envelope so that to provide higher quality of air ventilation and heating and cooling. Next slide. So the H&H partnership, again, super excited. I feel like I just keep gushing about it, and I've probably said this slide already now a few times, but I think it underscores our enthusiasm for having this partnership part of the project. So again, as you guys know better than I, the nation's largest public healthcare system. I think you see about 1 million patients a year. Unfortunately, I think the statistic is around 7% of the population you serve is either experiencing homelessness or at risk of homelessness. And so from what we understand from you guys, a lot of those people who receive services in the H&H facilities also tend to stay there and live there, or attempt to stay there and live there, or not stably housed elsewhere. And so H&H's Housing for Health program, and that their program at River Commons will seek to change that for the supportive housing tenants in the building. So not only will the community get this incredible 43,000 square foot health clinic, the building, the community at large, the tenants, the supportive housing tenants in the building will also have direct access to the healthcare facility. So in two ways, I think the partnership is incredibly strong, allowing you to expand the work that you do in the community and allowing H&H to navigate some of their most fragile patients directly into housing and directly into housing with a healthcare facility in the building. So I think H&H is incredibly excited about that collaboration, and we certainly are. Think that, oh, sorry, one thing if we could go back for 1 second, and it's critical. So what makes supportive housing work is by having supportive services on site. And so Shali and her team will provide social services on site for the supportive housing tenants. There will be offices and program space on site in addition to the healthcare center, totally separate. Well, they would be providing social services. I believe that let's hope that the ratio still is in the new tone of our country. One social worker for every 15 residents, supportive service residents. And so we will have a battery of social workers on site being managed by Shali's team, making sure that those tenants are integrating properly into the broader living community. And one of the things that H&H involvement will do will also be a navigator to ensure that able-bodied folks who can live independently in this building, who are within the H&H system, are going to be navigated through some city agencies, but into this building. And so we're going to make sure that with H&H that the appropriate folks or supportive housing folks are living in this building, and then Public Works is to make sure that they're supported in their journey in the building. So we're super excited about partnership and how we plan to support the formerly homeless tenants. Next slide, please. So like many affordable housing buildings of this size, we're going to have amenities, which is really critical to creating a vibrant and healthy community. There will be a 24-hour security front desk, which is incredible. There is a police station, just down the block, but it is a pretty quiet piece of River Avenue. And so we're excited to be able to have front presence. Obviously, things like community rooms, fitness rooms, kids' playroom, laundry room, bike room, all pretty standard, although we spent a lot of time thinking through how to make things beautiful as possible. There'll be a 15th floor terrace, which we're excited about because they're incredible views of the city. We're going to have on-site management office and, as explained, on-site supportive service office, supporting our supportive housing tenants, including medical monitoring, which obviously will be exciting because there'll be a whole medical staff downstairs as well, the clinic and stuff. So excited to be able to provide that level of amenities to the residents. Next slide. So again, activating River Avenue, that whole piece of rock will soon become a very classy storefront. We put the residential entrance on the corner. Especially, I was pushing for the H&H clinic space to be as close to the train station as possible. Just made sense. You're going to have a tremendous number of folks visiting, and why would they walk down the whole block just to access the H&H clinic? So right in the middle of the building, there will be a private entry for H&H, which will bring you upstairs to 2nd floor of healthcare. Adjacent to that, there will be the African Resource Center, again, really beautiful glassy storefront, and Bronx Arts Empowerment Center will be on the corner. What's exciting about those uses, both Bronx Works and African Resource Centers, is that they also have evening programming. So there's going to be a dynamic lobby that's going to have a 24-hour security, but you're also going to have evening programming. So, and obviously, incredibly, it's going to be heavily a long time on figuring out what the lighting should be to make this as dynamic a space as possible to them that it's under the train. We'll have security presence, but also security cameras and the like, just to make sure that we have eyes on the street. That's it. Next slide. So I think one of the things that captivated HPD from what we understand was the public plaza. Again, having just built 3 acres, not so far away on the Harlem Water Riverfront, we were excited to, bring more open space to the Bronx community, but also felt pretty equipped to do that. Again, wanted to recreate the community engagement. So we had a number of community design workshops. Bronx Works helped us put together, and we also personally
had a great time putting together a program with Wedco, not a local not-for-profit team program, who were super smart and should basically all become architects and city maintenance if they're not already. And so that, and super interestingly, what came out of that process was that people really, even the young kids, wanted a little bit more of a passive recreation experience, like a place to chill. I won't get into the intricacies of the great difference, but so we're gonna have a lower portion of the plaza that you can have green markets in. The Bronx Works has a number of green markets, or the African marketplace, and then you sort of work your way away from the elevated train into a shady spot where there's places for kids to play, adults have game tables, and then just a lot of beautiful trees and recreation. It's actually gonna be a pollinator garden with some educational programming involved with that as well. So we're super excited about that. So back to the building itself. 328 units, we can see on the screen now, a mix of studios, 1s, 2s, and 3s. The 2 and 3 bedrooms are well, a lot of the H&H referrals will be will be individuals. That is currently what the need is in the H&H system. And so what that's going to do is a lot of the studios, I think, will be again individuals through the H&H Housing for Health initiative, which allows the 2 and 3 bedrooms to be really accessible by the broader community. We started with a different number of 2 and 3 bedrooms, but again, the council member and the borough president prevailed, and we were able to increase the number of 2 and 3 bedroom units to accommodate families in the Bronx. We know that's a huge need within the parameters of HPD's program. Again, through the ELA program, which means the area median incomes are everything from 30 to 80% of area median income, less than 30%, less than 80%, and 30% of the units will be set aside for forming homeless individuals. Again, through H&H navigating through the programs. So where are we? It's been a long road. We finished the clinic renovations, as I said. We are targeting closing in December with HPD. There's an asterisk, but we bug them every day, and they're here, so you can bug them too. We're going to start construction immediately thereafter. We anticipate construction to be done in April of 2029. We begin to lease up, and then we expect full occupancy by the end of. So we are really on the precipice of getting going. We could not be more excited, and we could not be more ready. I think the last thing we wanted to touch on the last slide is a real commitment, obviously, Type A Projects has to MWBE participation, and that's everything from designers, architects, all the way to subcontractors. You know, whether you're a concrete firm or providing sheetrock and plumbing. The city itself has very high and aggressive goals. We meet or exceed them on every project. That's both Type A and LNS, really in the fiber of what we do. Obviously, as we WBE, be pretty absurd if we didn't. And the way we do that, the way LNN particularly does that, is by reaching out very early, which we will start to do soon, to local and MWBE firms doing contractor fairs, so they know what's coming up. And then they also work very closely with smaller firms to help them with the bidding process, help them get through it, and help them be competitive. So there's a division in LNF that does just that, and they have a pretty impressive machine. And then also during construction, we're required to, but also prioritize local hiring, which we do by doing our own outreach, by working with Bronx Works, and also by working with other workforce development not-for-profit. So we take both workforce development and FVPE participation very seriously, and we have the numbers to prove that it ends up working out if you prioritize it. So I think that is my last slide. So I just want to end by saying again, we build affordable housing for a living. This partnership with H&H has really supersized the impact for us, and I think the community, and we couldn't be more pleased and proud to be providing expansion to such a beloved and important option next to Thank you for your time.
So much there. Was I would turn the meeting over to Ms. Stone and ready to give speaks.
Thank you so much. So no, we are here to hear from the public on the project. It's just been described. Also been submitted to the Hospitals Corporation and River Conference on first C. We will be taking testimony this evening. I think that the time for registration is closed, so we have only one speaker tonight. So I'm going to go very quickly over the rules. It's actually 5 minutes over since to speak. We have time, and feel free to tell the time it's supposed to expire. And we'll write our roughly to double 5 minutes. All of the remarks, the speaker's remarks will be not only heard by the board members who are here, but transcribed. And anybody who was ready to submit a written statement to speak, you can submit and see either by seeking or my to and with that, I think I'm going to start with Dr. Morales, who is a member of the research.
Very intensive, well thought out development strategies to develop housing in this community. My company is Builders Benchmark. We've been in for over 30 years. We've been doing major community organizations like Acacia Network, which is the largest Hispanic organization in the country. The only comments that I really have is that when this project, the only notice that I've ever identified was when there was a notice for public hearing. But, there should be some participation in local professional groups that have been involved in doing development for a long time. As a Hispanic, we've always been limited to getting capital, financing, and getting in the main pipeline of the development process in New York City, and especially the Bronx. Project represents probably, I'm estimating probably $500 million. But in the presentation, I don't see, there is some RFPs. I'm sorry, we're WMPE Corporation. And so what we're looking for is some kind of involvement and participation in the process, even though this may be a fait complete, it's already thought out and built out. But there should have been some more outreach to try to identify some local talent, professionals that could participate in the process of developing a project. Business, we do basically exactly the same thing that they do. But we're a small minority firm. Any questions?
No. Well, we'll take your comments, share them with the board. And with that, we'll just first of all this movement to conclusion.